All right. Hello, everybody. Thank you so much for being here today. I'm going to get started just because we have a lot to cover in a pretty short time, but as folks come in, we do welcome them. Um, I would like to keep transcription on if folks are okay with that. Somebody requested to turn off transcription. I'm going to mostly be the one talking in this session, and I think it's helpful for accessibility for folks if that makes it easier for them to follow along. Um, So thank you so much for being here. This is using data to strengthen your CCAMPIS application. We know that CCAMPIS is a Child Care Access Means Parents in Schools grant program. This is a presentation from our team here at the Urban Institute as part of our Data to Action campaign for parenting students. We'll share some more resources about that in a moment. But we are excited to be here today. I'm joined by my colleagues Afia Adugiamfi and Kimberly Salazar. As well as myself, I'm Teresa Anderson. I'm a senior fellow here at the Urban Institute. I'm the lead of the Data to Action campaign for parenting students. I'm also co-lead of the Student Parent Action through Research Knowledge Spark Collaborative. If you all are familiar, we'll be dropping some links into the chat. I want to acknowledge that we have a larger team that has helped with generating insights that are helpful for this. And we really welcome you all to be here. So if you wouldn't mind saying hello, please feel free to share your name, your college or organization, what role you're in, and if you've received a CCAMPIS grant in the last 10 years, and if so, what's one thing you've learned or kind of a lesson from that? I just think that's a nice way to open things up. I also want to help you all feel like you're ready for this session. So to get the most out of it, we do encourage that you open your CCAMPIS application draft or a notes document and have it ready to jot down ideas. We're hoping you'll have a chance to do some real-time annotation for yourself. We have a lot of QR codes and links. We'll be putting the links in the chat. We will have QR codes on the slides. I want you just to be ready to grab those if you see something that is going to be useful to you. We feel free to put questions in the chat or the Q&A. Honestly, either one is fine. I think the chance that we get to questions are going to be kind of low. There's a lot of information, and a lot of people are going to have really specific questions that might not kind of meet the broad focus here, but we are tracking those, and if there are some that are going to be helpful for everyone to learn from, we really do welcome those to come in. But we do have a way for you to ask questions of each other and to build a community that we'll be sharing in a moment. And then we think it could be useful if you want to schedule a meeting with your team to talk through any ideas that emerge from this session, to get that on the calendar. If you haven't already engaged with your institutional research office, if you're at a college or university, be ready to call them up. I suspect they will be folks you want to be talking with if they're not already part of your planning and strategy. So with that, we're going to dive in. I mentioned that we might not have all the answers, but your colleagues might. So we, as I mentioned, the Spark Collaborative is a cross-organizational collaborative that puts together resources around supporting parenting students. There you can join for free. It's a values-driven membership, and we have some resources, and one of them is a set of constellations. It's on a platform called Circle. Constellation is really a space where you can connect asynchronously, sort of a message board of sorts, where you can create community. So we have set up a platform for folks who are either current or CCAMPIS grantees or who are applying to the CCAMPIS. And we have some friends who will be helping facilitate that space, which we'll be announcing more about that shortly. But we do encourage you, if you'd like to ask questions and be resources to each other, that is always very welcome. One thing that we've always appreciated about the CCAMPIS community is that folks have been generous in being supports to each other. So I am not going to explain what CCAMPIS is and why it's here. If you're in this session, you probably have a good sense of it. I'm not going to waste your time, but I do want to make sure that we have some relevant resources at our fingertips. So one is just the U.S. Department of Education site, which includes webinar slides from their webinar a couple of weeks ago, as well as the FAQs. There's also the grants.gov posting, which I'm sure many folks are already familiar with, but that's the official grant application portal. As we know, U.S. Department of Education is partnered with U.S. Department of Health and Human Services, where HHS is actually administering the grant. on behalf of the U.S. Department of Education, which is super confusing. But anyway, it's on the grants.gov portal. Um, the solicitation that was released is has a lot, but there's also a formal set of selection criteria that's actually in statute. And I want to make sure that if you haven't looked at that, that's something that you have a chance to um, look at, because I think I can't say for sure what's going to happen. I'm going to have a caveat about this in a moment. But that is something that will probably drive the scoring criteria in more detail. So I want to make sure you have that link. And then we have compiled past awards for CCAMPIS grantees if you wanted to look at who has received awards, the amounts and the years, as well as which states those have come in. That just can be useful for reference if it feels interesting. I want to share a few key tips. These were shared by presenters at the Ohio State University Student Parent Success Symposium in 2024, and by some experienced CCAMPIS colleagues, colleagues who have received CCAMPIS grants multiple times. So this is, conveying others' expertise here. But they suggested to use language from the solicitation exactly. Reviewers had flagged missing terms like low-income student as point losses, so don't use other terms, like use theirs. Repeat the prompts in sentence form as kind of topic sentences to make sure it's really clear what you're responding to. Write for a general audience. Many reviewers in the past have been legislative staff or others who may not have super specialized knowledge on this field. And then present data visually where you can. I admit my presentation is probably going to be a little text heavy, but when you can have visuals, that's great. Okay, this is my big disclaimer. Sorry, it's in big letters, but I just want to make sure it's clear. So the session's for informational purposes only. The Urban Institute does not have any advanced knowledge of how applications will be scored by the U.S. Department of Health and Human Services, and participation in this session is not a guarantee of a funding award. All comments and suggestions are those of the presenter, that's myself, as my colleagues here, and do not reflect official positions or recommendations of the Urban Institute. So I don't have any special knowledge beyond anything else, but we are trying to be helpful where we can. We will share the slides. Thank you so much for raising that. We'll be posting and sharing those afterwards because there is a lot of stuff in here. Okay, so I'm going to call out a few data-driven elements of the solicitation, and I'm going to be going through each of these in the session. In between each of these three kind of presentations, we're going to give you a little bit of just like quiet work time. This isn't the kind of thing that makes sense to break people out into breakout groups and such, because I know you're working on your own application, but we just want to make sure you have a minute to process or jot down notes in your own materials. So the first here is the section need for the project. That's 24 points out of 100. The secretary considers the extent to which the applicant demonstrates, et cetera, the following: information regarding student demographics, an assessment of childcare capacity on or near campus, including information regarding the existence of waiting lists or existing childcare, information regarding additional needs created by concentrations of poverty or by geographic isolation, and other relevant data. That should probably look familiar to you all because I'm sure you've been looking at this solicitation. This section about quality of project design. I just pulled out two sections of this. There's a lot of things under this heading, but the two sections that are the most relevant are the extent to which the design of the proposed project demonstrates meaningful community engagement and input to ensure that the project is appropriate to successfully address the needs of the target population or other identified needs, and will be used to inform continuous improvement strategies. If that's not a long sentence, I don't know what is. And the likely benefit to the intended recipients as indicated by the logic model or other conceptual framework of the services to be provided. And finally, the quality of the project evaluation, which is where I get really excited. I love program evaluation. That was my training. But looking at the extent to which the methods of evaluation are thorough, feasible, and appropriate to the goals, objectives, and outcomes of the proposed project, the extent to which the methods of evaluation include the use of objective performance measures that are clearly related to the intended outcomes of the project and will produce quantitative and qualitative data, the extent possible. I'm really trying not to just read things to you that you know, but just to make sure it's all clear. And the extent to which the methods of evaluation will provide performance feedback and permit periodic assessment of progress towards achieving intended outcomes. Whew, okay, that was a lot of words, and I'm sorry. But we're going to get into it with things that are not just stuff that you've already read or maybe listened to in the government webinar that basically read the whole solicitation to you. So I want to call out because I brought these in from the statute. As I mentioned, the statute has the official scoring criteria, and I am not going to read all these words to you, trust me. I want to highlight a few things as we get into the need for the project. So first is this note about comparison to local, state, regional, national, or international data. The second is demonstrating the magnitude of need. The third here is addressing the needs of the target population, so saying what the need is and then making sure you're addressing it. The fourth is underserved populations. The fifth is the specific nature and magnitude of gaps or challenges. And finally, no, and finally, employment, sorry, this employment piece. So these are some of the elements that are in statute and may relate to how they score this. And I'm going to get into a few strategies to try to make sure you're kind of checking those boxes in a way that is effective. So the first thing is to ask yourself two questions. One, can you identify your parenting students? And can you identify your parenting students who are low income? Because that is specifically the population that is meant to benefit from this grant. So the first element here is identifying your parenting students. So perhaps you've already realized that FAFSA will not work. The redesign of the FAFSA that simplified out the useful indicator of having a dependent child. There is still a checkbox in the FAFSA about whether a student has any dependents. But the skip logic that's in the current FAFSA means that that question is displayed to a very, very small subset of FAFSA completers to the extent that you're really not going to get data from FAFSA about students with dependent children at all. And we have a blog post that talks exactly about that, which is what this QR code and link references. And Afia will be dropping links into the chat as we go so that hopefully they're easy to follow along with. The ideal, if you're doing things exactly how you hope, and some folks have been involved in our data action campaign at various points, is routine data collection. So that means ideally you have a point at application to the college where you identify students who are parenting, however that may be defined within your state or system, and then having some kind of routine data update, perhaps annually, perhaps semesterly, like a registration intake form or a nudge that gives you updated information about folks who may have become parents in the interim, or if you define it as having a child under 18 who may no longer kind of qualify based on the age of their children. That's the ideal. On this link QR code on the left, we have a ton of resources in our Data to Action Campaign for Parenting Student webpage about how to do this. This isn't something you're going to be able to implement before this application is due if it's not something you already have, but it's definitely something that could be valuable to think about as you move towards the future or if you're doing other rounds of this. But we have these great briefs. How should colleges collect parenting student data? This is version 2.0. It's a refinement of a earlier brief. And then how colleges can ask students about parenting status is a real specific, here's some wording you can copy and paste and adapt. So these are helpful if you are trying to implement routine data collection. And hopefully many folks are in that position, but we know that that's not the universal case. If you don't have routine data collection, that's okay. I don't think that's actually a requirement of this grant, but I will say that I think more folks are and in a more advanced data collection point because states have been increasingly legislating that colleges need to track students' parenting status as a social characteristic. But that said, if you don't have it in your systems, you can look to student basic needs surveys. Perhaps your college participates in Trellis's Student Financial Wellness Survey or the Hope Center's #RealCollege survey. You can look at student life surveys. You can also look at service utilization data like childcare services, if you've targeted grants, if you have any data collected by your Title IX office, any information about students who participate in TANF or cash assistance programs, or if you have information from student parent services or offices, if you happen to have those about use. Or you might talk to other related offices, your veteran services, your transfer office, foster youth, re-enrollment or reentry offices. Sometimes they may have forms or points of data collection that might identify students with dependent children. So talk to your colleagues and triangulate. And definitely, if you are not already talking to your institutional research office, they are probably your best friend in this data process. That said, if you just really don't have good data, and that's just what it is, you can acknowledge this explicitly in the application and describe how the CCAMPIS grant would help fill that gap. So, there's different tiers of data here. You have If you have great data, if you have medium data, if you have a little bit, or really you don't have it, be honest and leverage that to the best you can to identify your parenting students. That said, I want to make sure we don't forget this other half, which is parenting students who are low income. So we see in the solicitation that that's identified as being eligible for Pell, or those who would otherwise be eligible for Pell if they were not graduate students or in the US on a temporary basis. One tool that hats off to Ann Reynolds at Mount Wachusett Community College, who pointed this out to me, is there's a Pell, like there's an SAI calculator that you could use to proxy for Pell eligibility, at least on an individual student basis. Like if a student comes in and says, I don't get Pell, am I eligible? You could have them put their information into this calculator and see if their SAI is less than $7,000, then they would be ostensibly Pell eligible. So that has been a resource, at least on a student by student basis. I'm not sure if that would work, at the population level, but it's a great resource. All right. I want to point out some other key resources to have the strongest case that you can make in this section that points to some of those other areas I highlighted. So one is geographic isolation and concentrations of poverty, which is something that's mentioned in the solicitation. This is where you're going to have a lot of QR codes and links, so just keep an eye out here. So I just want to give you a resource. There's a poverty map by county and by census tract by the Census Bureau here, the first link, so you can look up your geography and indicate the poverty rate. There's a map of rural serving institutions. You can see what your RSI score is if that's not something you already have available to you. And then perhaps you're in an urban area and it's not that you're rural or geographically isolated, but things are really expensive. There's a really nice affordability tracker by my colleagues at the Urban Institute that can get data down to the congressional district level that indicates the cost of average cost of housing, average cost of childcare, and several other things using the best available data. I think the childcare data might only be at the state level in that, but I still think that there's this kind of the best available data that's really recent about the cost of living in your area. Another thing is childcare availability. So if you all have been part of the Data to Action campaign for parenting students, or if you've done the Family Friendly Campus Toolkit process, there's a profile of existing resources that is a really nice place to take stock of what's available on or near your campus that might help parenting students. And there's a whole childcare section. So that's just a nice thing to refer back to if you've already done it or if you want to take a look. I should note, by the way, we're actually working on a new, really cool updated version of the toolkit that's going to be like interactive and modular, but that's a side note. Keep an eye out. It's going to be really fun. Another resource is a childcare desert map. I will note this is from the Center for American Progress, which our current government may find too progressive, but it is the best methodologically out there to be able to identify childcare deserts. So I will say you can present that data with a grain of salt, but it is good data, even if it comes from a, left of center source, that might help. You can also reach out to local childcare centers to gather firsthand data. In fact, the presenters at the OSU SPSS session said that that's just like basic homework. Reach out to everyone in your area to get information on enrollment, costs, subsidy processes, and wait lists. You could also contact your local childcare resource and referral office if you haven't already. Some folks are co-located with them at their campus and some have no connection with them. But this childcare aware search will help you find your local CCRNR, and they might be able to provide some useful information about availability and waitlists in your area. And then one other point that we have heard is just to make sure you're not just focusing on the school year, but that year-round need, including summer, and that's a point that's been useful to mention in past applications. All right, so there's more. Comparisons with other parenting students. You saw that thing about comparing at the national and state level and all those things. So here's a few resources that might be helpful for that once you characterize your parenting students. The first is that the Spark Collaborative has a set of student parent profiles. There's some briefs, but there's also some really nice little one-pagers that's broken out by student parents at community and technical colleges, student parents at baccalaureate institutions, and other characteristics. There's like 11 different one-pagers, so those can be good to benchmark nationally. You can also pull those same data yourself. The National Post-Secondary Student AIDS Study is the source of the most recent data that's nationally representative and in most cases state representative about students' parenting status. And we have a tutorial on the Spark webpage about exactly how to use that tool. Once you get to use it, it is the most user-friendly data pulling tool that I've found, certainly for government data. It is very accessible, and you can pull lots of things like cross-tabbing with veteran status or gender or any other things that are relevant for your work. Magnitude of need for your students. I want to just point out something that maybe you all know, but maybe you don't. Not every parent needs on-campus childcare. There's a nice two-pager here that talks about the different types of considerations around care that parenting students might have. So really make sure you're justifying, what do your students need and how much is that need and where is it? So surveys or listening sessions can help you characterize what students actually want and need. And you can sometimes set those up pretty quickly, even if we're trying to get our application in a couple of weeks. You set up a listening session next week. You might be able to get some good input that would be helpful, even if you're kind of still in that process. I will note that the Spark Collaborative will release a childcare guide for colleges later this year, so keep an eye out. That's basically a menu. Let's say a college wants to help a student with childcare needs. Here are the different options. I'm sorry it's not out yet, but hopefully it'll be useful for the next round. One other tip that we've heard from past applicants is that testimonials by student parents have been powerful in past CCAMPIS applications. So it's not just the quantitative, but also that qualitative storytelling that can be really compelling to reviewers. All right. Other key points. Sorry, these are the last two little tan boxes you'll have to look at on these slides. But underserved populations. So think about other crosstabs. So online learners, part-time students, working students, adult learners, veterans, perhaps transfer students. Unfortunately, I will commentate Teresa Anderson. Unfortunately, race and gender are probably not valuable to emphasize for this application. And I don't, yeah, I'll leave it at that. So you can decide how you want to approach that, but I don't think that that is a priority. And there's been a lot of language in this work about not using any kind of DEI language or framing. And so that's something to flag. No matter what population that you crosstab with, show that they are underserved. And there's a really nice example of a college analysis. And if I have extra time, I thought about doing a live demo of this, but I don't. This is, if you're going to go to one link, I think this is a really great link to go to. An example of an analysis from Marianne DeMario from Monroe Community College, who's no longer at the college, but did this study. She's in their institutional research office, and she was able to show, who the student parents are, their strengths and their challenges, who's using childcare, and then the relationship between use of childcare and key outcomes. If you can do something similar for your school, if you can do something similar for a subpopulation like student parent veterans or adult learners, that can be really compelling. And I just think it's a great example of a really feasible data demonstration. All right, finally, employment. If you can have the data, finding out which programs your low-income parenting students are enrolled in, and showing how completing those programs lead to better employment outcomes. The college scorecard can be a great resource for that because you can look at kind of earnings outcomes for different programs at the institution level. In addition, you can also look for local or state news articles about college credentials and or the unmet need for childcare and the effects on employment and reference those. Let's say you have a city or regional newspaper that talks about how childcare has been a real barrier for folks to be able to complete degrees or to get jobs. That can be great reference material that contextualizes it, especially for your area. Oh boy, that's a lot of information. So this is where we're going to take a pause point. And this is not necessarily exhaustive, but I want to give you all just a few minutes to jot down some notes on your application or your note-taking tool. So the first is, are we identifying all our low-income parenting students as best we can right now? Are there any other data sources we can triangulate with, or are there ways we want to improve how we identify this population in the future? Do we convey other characteristics of our low-income parenting students? Do we compare with others at the national or state level? Do we make a data-informed case for the magnitude of need, including specific nature of gaps or challenges? Do we have any data from students themselves, like surveys, focus groups, intake forms that speaks to childcare barriers specifically? Do we have firsthand data from local childcare providers or CCR&R partners? Um, can we get more insight to support this case from existing sources or in quick new data collection activities? Um, have we described the local childcare market, cost availability waitlist, and compared it to what our students can afford? And finally, how can the approach be linked to better employment outcomes? So I'm just going to give you all, we're going to say 4 minutes. Afia has a little timer to take a few minutes to sort of just glance through your application or jot down some notes or ideas on these questions or others that have been raised in this conversation. Afia, is that project timer or that countdown timer working or?
Yeah, it is. I don't know if you can see it.
Oh, I might not be able to see it because I'm presenting. That might be the issue.
Okay.
No,
Can
I can't see
everybody
it.
else?
Oh, I see it in the corner. Yeah, it's
Okay,
in the top
great.
corner.
Awesome.
We have about 1 minute left, and then I'll keep talking, but hopefully this is giving you just a moment to annotate any ideas or to-dos that come. I love the little uplifting timer. It's much better than my alarm clock. All right. So with that said, we're gonna get into quality of project design, and hopefully this is useful for y'all. So here, as I mentioned, the official scoring criteria. I will not read all these words to you. I will just point out that um, uh, that it be measurable, that there be meaningful community engagement and input, that there be a logic model or other conceptual framework. There's some measurable targets. Um, Administrative data also comes up, and then performance feedback and formative data. The things I'm highlighting aren't the only things that are important in here. They're just the things that I want to sort of emphasize for the purpose of this data discussion. So that doesn't mean that you should ignore the rest of the words, but just trying to make sure that we're focusing on what I'm going to be speaking to. Data can be your strongest case-making tool. You can likely make the case for almost any program or approach if you have strong data to support it. One example that has been coming up in my head is, let's say you have really good data that the biggest gap that your students are facing is having good after-school care for their school-age children, and that one of the big barriers is transportation to after-school programs because the ones that are cited at the schools are full and don't have space. Let's say there's a provider in your community, the only good after-school provider in your community that has space is a local martial arts school that provides transportation. For some reason in my area, it always seems to be the martial arts schools that have bus pickup after class. Um, if you can make that data case, even though that martial arts programming isn't technically childcare, it might be called enrichment, even though it functions as childcare, there may be an opportunity to justify CCAMPIS funds for something like that. I can't promise if you propose this, it's going to get funded, but I will say that if you can show in the data that this is what students need, this is what's available, and this is going to meet the need in a meaningful way that addresses your outcomes, then that's going to be your best opportunity to make that case. Also, there may be things you've tried before, like some places have tried drop-in care. Use data to show if it worked and how it can be stronger under this grant effort. So if it didn't work before, why? Could it be improved? And if it did work before, that's great. And if you can show that in the data, I think that's a strong case to be able to build on that model. So there's mention in this of a logic model, and I'm going to talk a bit, maybe folks here are familiar, maybe you're not, but logic models are extremely useful, and I'm going to use it to make a few different points throughout the rest of this presentation. So I'm going to go over it quickly. Generically, a logic model helps make the connections between resources or inputs, activities, outputs, and outcomes. So resources or inputs are what's needed to operate your program. Activities are what, if you have those resources, what you can accomplish and what you're going to do, basically. The outputs are basically your performance measures. It's like the direct things you're producing through your program, and outcomes are the bigger changes that you want to influence through an effective and successful program. And I'm going to show you a more specific example here. So this is a kind of stylized one. We have inputs with some kind of generic categories. In a moment, I'm going to share some CCAMPIS specific examples. But let's say you have things like your service delivery model, you have curricula, you have service delivery partners, technology and tracking systems, staff and personnel, funding, technical assistance, participating households or families or individuals, students as it is. So that's here on the left, right? I like to actually, when we talk about activities, break it down into what I call functional activities, which are things that feed back into inputs like hiring, fundraising, promotion, that kind of create more inputs. And then programmatic activities, the actual things you are delivering to your participants that are going to influence their outputs or influence their outcomes. So here's some examples here, like functional might be local adaptations of existing interventions, developing procedures, identifying partners, funding sources, hiring staff, training, et cetera, et cetera, et cetera. But then you have your actual programmatic activities that is your service delivery. You then have outputs. So these are, perhaps it's enrollment in the program, completion of the program, participation in offered activities, completion of offered activities. You also could have system level outputs, so new infrastructure to deliver services or new partnerships for ongoing collaboration. These can be helpful to call out. And then you have short-term and medium or long-term outcomes. And that's ultimately the things that you don't have absolute direct control over the way you do for outputs, but they're really connected logically to what your program's delivering and what's meaningful change. You also have some contextual factors. I just put one example here, but there may be a whole list. But availability of licensed childcare providers, could be a contextual factor. It influences everything, but it's out of your direct control. So it's important to be able to identify those elements as well. It could be the local economy, it could be enrollment cliffs, demographic cliffs, it could be lots of things. So if we were to kind of make this a little simpler instead of a whole graphic and just kind of put into columns, it could look something like this format. And I didn't want to like put wall of words in front of you before I just had you get used to the format. But this is an example of perhaps what a C-Campus one could look like. This is one where there's federal C-Campus grant and some institutional matching funds. You have participating community childcare providers who are licensed family childcare homes, center-based programs. All of them are accredited or on track to accreditation. You have childcare navigator staff. In this program, there's also a navigation support element. Parenting support program staff facilitators, also a parenting support element. Student parent enrollment, eligibility data systems, financial aid and student services infrastructure, because in this program, the grant is administered through the financial aid office. On-campus office space, virtual meeting tools, community partnerships, student parents and their children, of course. Right, so here's just a generic example. It might look similar to yours, it might not. Some of the functional and administrative activities, when you apply for and negotiate funding, develop subgrant agreements, establishing eligibility criteria. There's a whole list here. I'm not going to read them all because you don't want to hear me read slides all day. But you can look through this and kind of see. There's programmatic activities as well, conducting intake and eligibility screening, matching students with providers, dispersing subsidy payments, et cetera here. This also includes oh, excuse me. I use CHC as a shorthand for childcare because it just is hard to write over and over again. That's my little personal shorthand. So if you're like, what's CHC? That's childcare. Sorry. But maybe you gathered that from context. But provide one-on-one childcare navigation, facilitate parenting support workshops or programming. Sorry, that should be on a separate line. It's an error. You'll see outputs, right? Number of students enrolled, number of children receiving subsidized care, number of childcare payments dispersed, etc. You also see system level. So it might be newer strengthens partnerships with community childcare providers. You might see provider quality improvement, etc. Institutional data infrastructure improvements, campus policy or procedure changes, and outcomes, right? So maybe in the short term, you see reduced stress, increased childcare knowledge among students, increased confidence as parents, and improved childcare stability, like fewer disruptions for the children. Maybe in the medium and long term, we think about improved credit completion, higher term-to-term retention, increased degree or credential completion, children experiencing higher quality childcare environments, and student parents build economic stability through credential attainment and employment, right? As you're going through this, you're putting your inputs and your functional administrative activities together. If you're identifying that, here's a few tips. Be as specific as possible. Put in numbers and timing. This example doesn't have that, but it is nice if you can say, hire 2 navigator staff or half an FTE for this or this many students that we want to come into the program and who will do each activity where possible. Not just, apply and negotiate funding, but who is going to apply and negotiate that funding. It's good if you have a subject to those bullet points. I don't here because it's generic, but it's helpful. This can be useful for planning, developing your job descriptions, making sure you have what you need to do this well, but it also really can align with your management plan, which is a whole other section of this application that I am not talking about in detail, but that can be really informed by having this well specified. Programmatic activities. So gather input from program participants and community members. You can get surveys, community feedback sessions, or other mechanisms to inform what you're going to do. Track these information using program data as well. So gather input not just in defining what you're going to do here, but also how well it's working. That's what I kind of mean by this. I should have been clearer. But what I mean is when you have programmatic activities that are in the model, you're tracking whether that's really happening in some way, both through input and program data. When you're going along in your operation of your program, some things might not appear to be working the way that they did in your model. So there's 3 possibilities. That's an implementation problem. It's not happening the way it's supposed to. It could be a measurement or data problem. It is happening, but you're not capturing that it's happening. Or it could be a problem with the model. It's happening in a better way that the model needs to be updated. So assessing and refining based on that input can also help inform your grant amendments in future years. But showing in this application that you're going to be thinking proactively about that can be really strong. Outputs and outcomes. I'm going to talk a lot more about this in a minute. Mostly make sure these are measurable. We're going to put a tab in the wall on that one. I want to mention just briefly this great resource that our colleagues Afia and Kimberly, who are on the call with me today, helped co-create with student parent advisory board members. So there's this meaningful community engagement and input element. If you're interested in having parenting students as co-leaders in your program or having like a student parent advisory board, this is an awesome resource. The rubric for the authentic engagement of student parents is a way to make sure that input and co-leadership is effective, that student parents really can do that, be at the table in an effective way. So I'm going to put that out there as a resource. All right. So this is another pause point. Just checking my time. I think we're good. Give you another 4 minutes, let's say, to jot down or skim your application draft for the following. Do the data strongly motivate our proposed approach under this grant? Do we communicate our program model well? Inputs, activities, outputs, outcomes? Do we have a way to measure and track each of these, whether qualitative or quantitative? Do we have a way to gather meaningful community engagement and input in program design? What about as the program is underway? Can we bring parenting students in as co-leaders or advisors for this program? Do we have a way to feed insights back into program design or to continue to strengthen it over the grant period? And can we like convey that in our application? So I'm going to stop talking and we'll put another 4 minute timer up. All right, about 10 seconds left here, and then we'll be picking up where we left off. There's our uplifting music. Love it. All right. So, quality of project evaluation. This part I get excited about. I'm a nerd. It's okay. Um, so there's again, as you've seen this before, I'm going to highlight a few things. So one element here is fidelity. Another is performance measures, performance feedback, evidence about the effectiveness of your program. So they mentioned this What Works Clearinghouse standards without reservations first. And then there's a reference here to What Works Clearinghouse standards with or without reservations. I'm going to talk about what that means. Appropriate analytic strategy, dissemination strategy, and access and link high quality administrative data. So these are some things. Again, that doesn't mean that other elements, points here aren't important. These are just ones I want to emphasize for the purpose of this conversation. All right, we remember our logic model from earlier. So I'm going to put a few more annotations on here. Measuring programmatic activities and how well they're going is actually speaks to fidelity. So fidelity is, are you actually doing what your model was designed to do? And how are you going to ensure that it's adhering, what you're doing is adhering to the model? Um, so you want to explain in your evaluation plan how you'll document any deviations from the original model and have a way to document program changes over time. Because again, it could be an implementation problem, it could be a data or measurement problem, or it could be a model problem or problem with the model. And you want to have a way to deal with each of those situations that you're being thoughtful about. It's also good just to make sure you have a way to like annotate those changes over time because as you have to do your annual performance report, you'll want to know, oh wait, when did we change this thing or when did we start doing it this other way so that you know how to report back on that. Outputs. Outputs are your performance measures. So that means the things that directly tell you, are you actually doing the programmatic activities that you think you're doing? You'll want to choose measures you can actually track in some way and have a plan to monitor them. So they'll be necessary for grant reporting, of course. It also speaks to this concept called program dosage, which is how much of the intervention are participants actually getting, and also participation patterns. Which aspects of the program are which participants receiving? In this example model, there's a few different elements. There's the navigation, there's the parenting support, there's the actual um, childcare subsidy. There's different pieces of it. So how do you know who's getting which pieces? Because that'll also help you when you're thinking about your evaluation approach. Outcomes. Specify your outcomes well because that's how you're going to show impact, which is the core of any evaluation. And you want to know how to measure every outcome. So I'm going to annotate this in some more detail. Um, these short-term outcomes, right? So reduce stress, increase knowledge, increase confidence, more stability, and also children experiencing higher quality childcare environments down here, medium long term. Could you do a semesterly survey or questionnaire of your participants? Could you gather any qualitative data? A note that we got from previous grantees is that quotes and testimonials can be helpful for the APR and renewal application as well. So that can be nice to have maybe collecting as you go along. For these medium, so improved credit completion, higher term-to-term retention, increased degree or credential completion. These may not be your outcomes, right? But if they are, can you track things like this with your institutional research office? I've mentioned they should be your best friend here. Um, and I'm going to make more points on this, but it's important that you know who you're going to be comparing against. I'll be talking a bit more about the comparison group, but ideally, you're going to be comparing against parenting students who are not participating, but who are otherwise similar. So that could be concurrently enrolled, like they're enrolled now, but they didn't get access to the program because of ideally something outside their control. They didn't just say, I'm not interested, but there was a reason they couldn't participate. Again, I'll talk more about it. And it also could be from earlier cohorts of students, perhaps, like last fall. And then there's some things here, increased degree or credential completion, student parents build economic stability through credential attainment and employment. This is where it's really nice to be thinking about administrative data sets. So a lot of colleges have partnerships with the National Student Clearinghouse. You may already have an agreement with them to be able to link to track students' outcomes on their credential and degree completion or transfer. Um, Also, state earnings records. Some states have really beautiful statewide longitudinal data systems that actually already link higher education with earnings data. Kentucky is one of my favorite examples. Um, so looking at whether it's possible to track those earnings and employment outcomes that'd be really salient in an application like this. Um, as you're going through, this is a lot of outcomes. You might choose one key outcome that is meaningful and measurable that you're fairly confident you can influence to be sort of your key primary outcome. Because if you're trying to do too many things at the same time, in your like ultimate does this work evaluation, it can be a little hard to convey that. So you might say our key outcome is term-to-term retention because we know that that relates to completion and then relates to employment and it's good for students. And this is a major area of challenge that we've had with this population. So you motivate why, and then you can kind of focus more on that as we're thinking about evaluation strategy. All right, what is this What Works Clearinghouse? Some of you might know, some might not, but there's three ratings of evidence. So the first is meets What Works Clearinghouse standards without reservations. That's basically a randomized control trial, an RCT, sometimes called an experimental design. Um, these, and one that's well designed and well implemented, that means you have some kind of randomization in who's getting the program and who's not. The second is meets What Works Clearinghouse standards with reservations. That means the study has some potential issues requiring caution, can be a quasi-experimental study with comparable comparison groups at baseline, or a randomized control trial that's not so rigorously implemented. Um, Candidly, this is probably where a lot of you are going to aim to be. I'll have a slide in a second about RCTs, but it's going to be hard to do that in a lot of cases. Um, does not meet What Works Clearinghouse design standards. So the study's design is insufficient to support causal conclusions about the intervention's effectiveness. These would be like pre-post comparisons or kind of descriptive studies. It doesn't mean that you can't, if that's the best you can do, that's the best you can do, right? But just so you know kind of how that standard is measured. Um, could you do an RCT? If there are more eligible students than slots, randomizing applicants can be fairer than first come, first served. So that's something to think about. If you randomize people and you collect data from everyone who applies, so that includes those in your not receiving services group, and you include them all in follow-up data collection, like surveys and data polls, you have a great comparison group. In that case, you actually call it a control group. It like it's a whole other name when it's part of an experimental design. Um, as long as you kind of just check to make sure your treatment and control group are actually the same on their baseline characteristics, meaning, the kind of programs they're in, whatever you want to kind of profile about them, you can just directly compare their outcomes, and that's a really strong case for impact. They should be the same if it's really random who's getting it and who's not. If you randomize, a hot tip by evaluation folks is that you'll want to build in a plan to track what the comparison group actually receives. If a lot of your students who don't get CCAMPIS get some other very similar type of childcare, that's good to know because then you're basically just comparing one funding stream versus another funding stream. Like maybe they didn't get CCAMPIS, but they got some other local grant. Well, that's good to know because then you might not find huge impacts, and it's just because your comparison group also got something similar through another source. But a more realistic evaluation approach is that you have CCAMPIS participants, and this actually could apply to an RCT as well. So you have CCAMPIS participants, right? You have a reasonable comparison group. Ideally, it's other student parents who did not participate. I should say could not participate is even better. Like there's some reason that they didn't get in that wasn't just them choosing not to do it, because that's called selection bias. But those could be concurrent or they could be from earlier cohorts. You could also, if you can't do that, you could benchmark against all students and just, do the best you can, right? You can say, look, student parents completion is like half of what it is for our non-parenting students. So, or again, for all students across our institution at baseline. So we're going to show that this CCAMPIS participation brings them much closer to the average of our students. Like that's not terrible. It's not great, but it's not terrible. Okay, those CCAMPIS participants receive the program, right? You might think about separating those who are kind of high dosage participants, like they did everything in the program versus those who kind of did a minimal amount of things. You might also look at those who got different programming aspects. Like if you have an on-campus childcare and a community provider option, you might kind of separate out who got which if you want to sort of look at some subgroups. And you see their participant outcomes, right? The things that we talked about. Our reasonable comparison group, they have their comparison group outcomes. It's nice if we know what they received in the meantime. You might not, but it's helpful if you do, especially if you don't have a randomized design. You're not necessarily going to have all the information for your non-participating students. But if you do, that's nice. The main thing is that you're going to want to justify that you have a reasonable comparison between your CCAMPIS group and your reasonable comparison group. Or again, if you have to benchmark against all students, that you kind of know what the baseline is and that makes sense. And then you'll want to compare for impact. And as I noted, you might want to separate out some of those groups by the type of intervention, the level, or the type of stuff that they got. One note, I'm almost done here. I know we're towards the end of our hour, is to plan for data sources for characterizing participants, program participation, key outcomes, and fidelity and implementation. Make sure it's really clear to you and to the reviewer that you know where you're going to get the data for each of these elements of your program. And make your evaluation plan clear. So who will do the evaluation? Can you get an external evaluator or faculty member to serve in this role? There is an element of this that's about like the qualifications of your evaluator and their independence. What is the design? So more sophisticated research methods are clearly preferred, but may not be feasible. So those are ones that focus on adjusting for treatment and comparison group differences. There's a few other nuances to good evaluation, but that's the biggest thing. So basically, a basic pre-post, like their status before and after, or a descriptive analysis is kind of the minimum. Quasi-experimental designs with a justified comparison group are pretty realistic, hopefully. And then randomized control trials are sometimes called the gold standard, but they may not be feasible. We understand, I think the reviewers of this grant probably also understand that, but if you can do it, yeah, that'll be really strong. And then I'm just going to mention they have this discuss dissemination of findings. So how will you communicate about it and thinking about how you're going to share that out. All right, this is our final activity point. And since we're almost at the end of the hour, I'm going to present this, but then maybe you just take your own few minutes after we close out to be able to do that reflection. I was so close to giving you that extra 4 minutes, but do we have a way to measure fidelity of implementation, track performance measures, and measure program engagement patterns or dosage? Do we clearly explain how we will evaluate the effectiveness of our program? Do we have a reasonable comparison group? Do we justify why the comparison group we will make is reasonable? Do we have key outcomes that make sense and that we can track? Can we link to any other data sources? We mentioned a few earlier. Have we named who will conduct the evaluation and describe their qualifications or independence? And have we described how we'll use data for continuous improvement, not just for reporting? So data is not just to comply, it's to actually make the program better.
Oh, yeah, standing.
Um, so these are some things to reflect on. I'll pull this back up in a second. I just want to make sure I flash up here the thank you and good luck slide. This is my email address. However, I want to note I always like to be helpful, sometimes to a fault. I cannot answer specific applicant questions or provide direct feedback on applications. It's just not in my capacity in the next 2 weeks. But I do hope that you all can continue to be resources to each other through that Spark Collaborative constellation, which we'll drop the link in here again. And I will pull these questions back up if you do want to spend another few minutes reflecting on your application, your evaluation section, and how to ensure that that's as strong as it can be. So thank you so much. Please feel free to stay on as long as you need. And otherwise, I hope you have a great day and best of luck.